I'm going to speak on the patient safety and the role of the health informatics in the healthcare. These are the two areas which are very crucial areas in the field of the health.
Okay. And how do you think this would contribute to the Indian healthcare scenario, sir?
Yeah.
Looking at this scenario currently, how do you think these areas that you've chosen would
Now you are
contribute
seeing
to the
that
healthcare
nowadays
industry?
it is a time of technology, okay, and technology is
Yes.
overruling the
Yes.
human skills. So human skills are being overshadowed and overtaken by the technology. So I will be dealing this aspect, how we can manage
True,
this
sir.
technology skills and in comparison with the human skills. So I will be taking about the presentation, how it will contribute that in addition to the technology skills, how we can contribute our human skills as well in dealing with the patients and the healthcare in our field. That is the main objective actually.
That's really interesting, sir, because nowadays it's very important that people should, acquire the
Yeah.
technical skills plus also understand that they are humans
Yeah.
also, so they should know the skill. So it's very interesting area chosen by you, sir. And what should be the expected learnings of the delegates from this presentation of yours, sir? How should be
Yeah,
they
the
prepared
take-home
for
message
the
and the take-home
presentation
learning
for
message
your
will be
session?
for all the participants that, of course, the technology is going in a big way. We have to adopt the technology, but on the other hand, we should always take care of the human factors principles. We should not violate the human factors violations like long working hours. There is a shortage of manpower. Okay, there is a shortage of the medical manpower. So
Right.
we should not
Right, sir.
stress
Right,
upon
sir.
the manpower to work for long working hours, 12 hours, 18 hours, 16 hours. If you will do this, they are going to do the mistakes and make the medical errors. There is no doubt about it. So there are many things. We have to standardize the process. We have to standardize the procedures. There are many human factors which are involved now giving the healthcare. So this is very crucial. So I will be telling about all this, how we can balance between the technology and the human factors and the human skill, both these. So this will be a take-home message to all the participants.
And how would this presentation contribute? I mean, the thing is
Yeah.
that you're talking about technology and advances, which is actually the theme of the summit. So, do you think it's more or less the? I mean, you're touching upon the topic of the summit only, but then
Why,
technology and innovation, is it accessible and
why
affordable
not?
in
Because now
Indian
you see
healthcare
that
scenario?
internet,
Talk about
mobile, I am taking a topic on e-health, okay? And e-health is nothing, but everything is in your hands now. You see, you are having the mobile technology, then
okay,
you are
okay,
everything is on email, e-things
right,
are going on. So everything is now available, affordable and accessible now. Everything on internet, you go and you can see
right, sir.
101 treatment options for one disease. So this is nothing. So technology has made the healthcare technology and the
Human.
human view also. I can, of course, it is robot is there. He can operate. He can do, but human touch is not there. So we have to balance the human touch as well as the technology. This is the this should be the objective. So healthcare will be affordable and accessible. There is no doubt about it. And technology will help this. Technology is
Right, sir.
helping, right?
Right,
So
sir.
these,
Right, sir. And sir, could you just talk about in brief about the summit? I mean, this is one of its kind summit that we are organizing in Hyderabad. So, could you just speak about the summit and what relevance does the summit have with the healthcare scenario that we have currently in India? Will it change the mindset that people have currently?
very
Because
rightly said. It is the basically things is the because you see mindset is the most important thing. You have to change the
right,
mindset. Okay,
right, sir,
and for
right,
the
sir.
for mindset change, you have to change the entire scenario. For that, human resource management, what we call it is very crucial. Human resource management, what we call in the health sector. So this is very much relevant that you are managing each and every aspect of the healthcare under one umbrella, and how we
Correct, sir.
can innovations and the recent advances in the technology field is being implemented in healthcare. So this will help in a great way for all the participants that how we can do that. And the whole all healthcare is being changed because, as I said before, technology, and technology. So we are going for the how we are balancing between the. So this is again the same and one and the same, right?
Right, sir. It's really interesting to know that you're talking about technology. So, because when we talk about technology, in many cases we have seen that people are really they have an aversion towards technology when it comes to healthcare. Otherwise, they accept
That
technology.
is what I'm
If
saying.
you ask doctors,
You see,
that's what.
even if you see a child, now the
Huh.
child is also playing with the computers and the technology.
True,
Okay,
true.
but on the other
True,
hand,
sir.
we are having certain elder people who are afraid of using the computer. They think that computer is useless. So we have
Yes,
to
yes.
make the balance between these
Balance.
two.
Huh.
So it is an opportunity as well as challenge both. You understand?
Correct.
But for youngsters, now
Very
the
true, sir.
younger generation is coming. They all know about
Hmm.
internet and this technology, mobile, iPad, iPod, all their mobile health. Oh, they are using. They are already using all this. Am I right? Social media, they are
Yes, sir.
using Twitter, your
Yes,
Facebook.
sir.
They are
Yes,
already
sir.
using. So they can use this technology in a much more better way than the elders and the older people.
Right.
Of course, they should know. But
Right.
opportunities are
Right, sir.
there. Challenges, I think opportunities are more and challenges are few. This is my message.